First of all, I would like to thank Stan and the HitLab team for inviting me, and it's my honor and pleasure to be here this morning. My background is more of a clinician, so I'm a frontline worker dealing with the nuances of healthcare from the enterprise, the providers, and the patient's perspective. How I got into generative AI was my interest in NLP, conversational AI, and then generative AI, the fast evolution. So the agenda for the talk today, I'll go over some introductory concepts of generative AI, but this would be more like application-based, high-level talk, not more technically focused. What's the current state of foundational models, and what are the real touch points in augmenting and potential applications? And I'll wrap up with some challenges, concerns, risks, and adoptions, and some future directions. So before I go to the audience questions, I want to tell a very short story of what I did. 7 years ago in 2017, I presented a project, a little concept of cognitive personal digital assistants for physicians. At that time, that's when the transformers just came in, and I was quite naive and presented just because of the whole issue of physician burnout. This would be a fancy version of Siri. It had multiple tasks, multimodal input. I asked many people as to, is it possible? And the answer at that time I got was, you have to take it bit by bit. Fast forward 7 years later, and even like 6 to 7 years later, we have the whole transformative introduction of GPT 3.5, ChatGPT, and since then, it is a nonstop parade going on. So I would like to first ask the audience as to questions. What do you all feel? Will generative AI be helpful in practice of medicine? How many people feel that it's yes, we are hopeful? Show of hands, please. Good. How many people are skeptic? Okay. And how many people are no, we are concerned? So the sentiment I'm taking is actually hopeful and skeptic, and that's where we should be actually optimistic, basically cautiously optimistic. So what's the current state? Since last year, and actually going on behind for a few years, since the GPT-1 came in, actually there has been a rapid evolution, more so this year, of large language model, foundational models, and domain-adapted models. The problem is we are facing a big chasm in healthcare. If you look at the overproduction, and as compared to implementation, deployment, and research and real-world evidence, whether this is helpful, it's not working, or working. And in this chasm, we have major concerns. We are not sure of what the risks are, how they would be as we implement them. Uncertainty, definitely there is an uncertainty, apprehension, and again, questionable utility. For us to implement it, who is going to pay? Would it be helpful? Again, the bottom line and all these questions. In the era of co-pilots, custom GPTs, agents, and assistants, naturally the big two important questions are, people feel that maybe if we don't adapt, we have apprehension of lagging behind, versus what if we are adapting too soon? So some of the introductory concepts, everybody knows what is generative AI, but we'll start with the foundational models. That's where these are the building blocks of generative AI. So these are large, deep learning models, pre-trained on vast quantity of unlabeled data, and designed to be fine-tuned or adapted to a wide variety of downstream tasks. Large language models are just one particular instance of these generative AI, but basically they generate novel combination of text in the form of normal or natural-sounding language. So this is from a paper came from Bomasani's group from Stanford. That's where the foundation models were coined. But basically, it's a very generic model. You have multi-stream, multimodal data input, training of the model, this big so-called big box, the wonder box foundational model, which can be adapted downstream for downstream tests. Adopting this and actually transposing this model on the healthcare perspective, a medical foundation model, this is more current and or futuristic as well. again, from the data from the healthcare perspective would be multimodal data. You have the natural language, you have the images, we have the sensors, audio, video, multiple streams of the data. And these data can be used to train a model, that's your foundation model. Two instances of these models in clinical perspectives would be clinical language models, that's the CLAMS, EHR foundation models, that is the FEMR, foundational EMR models. And now upcoming, actually, every day a new multimodal model is, or new multimodal models are coming with audio input, video input. Now, and downstream, these models can be fine-tuned. There could be multiple stages of fine-tuning, but basically these are adapting to the tasks, different tasks as mentioned below. Most important thing is, again, from the user perspective, there is a natural language interface and an important component of human-AI interaction, which is how do we collaborate with these so-called task-adapted models to get the best use for the end user. As far as clinical foundation models, I'll not spend much time. There are two categories, and of course, this is evolving. Number one is a clinical language model in which input would be clinical text and output would be, again, a clinical text or a representation, which can be used further for either for generative tasks or used downstream for the second machine learning model for the predictive tasks. One thing which is overlooked is actually the foundational model for electronic medical records. Actually, that is an important part where you have patients' longitudinal history against the timeline, and what the model does is the output is embedding and representation, which can again be fed into the downstream models, and that brings a predictive model, a prediction task that facilitates for as to this patient over timeline, what have we learned, how has this patient progressed, and if you accumulate this over population actually, let's say what this subset of heart failure patients, what was different, and that helps us in deep phenotyping and also more of personalized and prescriptive medicine practice. So creating value and competitive advantage with generative AI, let's look more from the broader perspective, actually. We need to rethink the machine-human interaction. And what can we do? Actually, we can integrate intelligent digital touchpoints where there are frictions. And from these digital touchpoints, we can get data and data-driven decision-making, also offer innovative products and services, and ultimately, the goal would be to enhance the patient and provider satisfaction or experience. That's what they are the two main components of the healthcare delivery. This is just a busy diagram basically showing touch points of generative AI in healthcare delivery. I have divided them into 4 buckets, the physicians, and when I say physicians, actually would be clinicians, and even we can include the nursing staff as well, who are our important partners in healthcare delivery. And the patients, naturally, we serve our patients. How can the patients be helped with? Enterprise, at the level of enterprise. How does an enterprise place itself forward in this competitive landscape? And ultimately, also for the research, how can research be transformed and actually get more involvement with digital touch points and more patient entry into it? So any technology, actually, we have to rethink in the broader perspective, the human-centered, what's going to be the advantage? I take it from people, process, system, which is microsystem, macrosystem, ecosystem, however you want to define, and that's ultimately is the technology. So if you look at the generative AI, let's look at the burning problem which we are facing. Focus on people. Who are the caregivers, the physicians, all the clinicians, and physician burnout is a major problem. That's from the American Medical Association, actually. About 60% burnout. You'll get some statistics like this. But what are the causes? If we do not take care of this burning problem, we will have problems downstream. So one of the important elements of physician burnout or clinician burnout is actually administrative tasks. A lot of new solutions are coming into ambient clinical intelligence or ambient solutions from Nuance and other companies as well are coming up. So basically, if you look at from the broader strokes, from physician perspective, what are some of the applications as I mentioned, ambient clinical application in which when the task of notes writing or note generation is streamlined, automated, and goes into the EHR. So it gives a clear interaction in that limited time between the physician and the patients. Of course, when I can tell you from my personal experience, when I'm dealing with a patient actually, and I have to give more face time to the patient at that time and look at the patient, read the body language and their concerns, I need to spend minimum time with the EHR at that time. Could I have an intelligent assistant with me in the EHR? You can call it as an assistant, you can call it a co-pilot, but it doesn't matter, which would have a voice interface. So I can just tell with the voice, I can just command with the voice, instead of me going and clicking and going to this system and coming out, entering passwords. No, just keep it seamless, just have a good assistant to the physician or clinician in the EHR. Up-to-date summaries, actually. When the patient is being seen by the physician, a lot of things have happened in background. The patient went to the urgent care center, patient got into the ER, a lot of labs were done, was seen by the other consultants. So naturally, all of these can be updated by the digital assistant, and also some of the other tasks which I have mentioned. Last two I'll emphasize basically is deep CADS, or the computer-assisted diagnostics and clinical decision support, which is upcoming. There was a recent article in Washington Post about use of generative AI, potential use of generative AI in rare diseases. Recent article from Harvard Business Review actually also mentioned about the clinical decision support. And then precision medicine, which I mentioned earlier. This is actually just, I have highlighted about how a physician-facing application would look at intelligent EHR. So when I'm seeing a patient actually in the EHR, I give a voice command. Just the simple thing is, what was the ejection fraction? That's one of the indicators of the heart function on the echocardiogram on the last echo and the trend over the last 3 years. That's my prompt, that's my command to our EHR assistant. The EHR assistant goes to the echo database, pulls out the information, and brings it out to me in a voice format. The EF was 50% on January 4th, 23. And the second response is actually the EF trend dropped down to 40%. At that time, the patient was hospitalized on such and such date due to COVID. So I get a perspective, I get analytics, my simple prompts, but I get a much more visual output, audio-visual output, and that helps me out. Now, this slide actually is an important one into the how does generative AI bring up, makes us more creative. So it's a human-machine creativity. It's actually a creative storytelling that drives bold health changes. When you have a limited time, actually, the patients do feel that sometimes they don't get enough time with the physicians. And of course, physicians have the constraints as well. But within that time window, how can we maximize our interaction? How can we have a good dashboard, an intelligent dashboard, which is powered by generative AI, which pulls out, this is much more fancier version, but basically which pulls out in some nice format as to what the patient's trajectory has been so far, what are the test results in simple terms, in patient's language, what do they mean, and where do we go forward. So that's like a creative storytelling from the physician's perspective to the patient, and it's a shared decision making. The patient should have a good understanding of what's going on, why should I follow these instructions, and once you have a patient buy-in, actually, that's much easier for the patient to kind of go forward with. And that's an important thing where the technology can running behind can help us in healthcare. When we look at the patient experience, we need to look at the total holistic perspective, actually. It's the whole cycle of patient journey at home, in outpatient care, inpatient care, and paying attention to the social determinants of health, inclusion, health, equity. So a patient perspective, the health comes from the patient perspective. One of the applications would be patient portal digital concierge, in which patients can actually question the digital concierge in the portal about appointment times, help in navigation of the appointments, and also if there are any complex notes written or test results, the assistant can help the patient as to with the interpretation and with further knowledge. Last year, we published a paper in heart failure clinics. It was a digital version, and actually we conceptualized this model of, this was before the ChatGPT time. This is what we had mentioned about a model of virtual health assistant, which is conversational, using conversational artificial intelligence as to how this would be, how this would pan out for heart failure patients. Actually, we based it on the 3 functionalities. Number 1 is assistance with the care, acting as a digital front door with the healthcare providers and with chronic care management and wellness. And of course, now it's coming to fruition with the foundational models laying the backbone of these kind of virtual assistants. This would be a value pyramid of how this voice-enabled digital assistant powered by generative AI would create value along the 3 lines. Number 1 is assistance and automation of tasks, enhanced digital experience, and ultimately leading to adherence and engagement. Enterprise-facing applications, I'll touch just quickly 2 points. Number 1 is immersive enterprise web page experience. When the patient touches the enterprise, at the time, the web page should be so immersive experience that the patient is basically tries to get the maximum input from the enterprise web page, and that could be like a sophisticated chat voice-based experience, removing the friction out. The second part would be actually about the case management digital assistance, actually helping some sort of integration of geographical information system technology along with the case management, whatever you have, the application, so that when you're discharging a patient, especially a high-risk chronic care patient, you have the complete picture, a creative discharge summary which the patient can understand, and highlighting what are the barriers, social determinants of health, and how the community resources can be actually leveraged for this patient. And I saw recently this has been here for a few months, this event such as the Generative AI Hackathon. Basically, this was from NYU, and that's why it brings the concept of learning healthcare enterprise, in which you can create sandboxes, boot camps, hackathons, and collaborative ecosystems for generative AI advancement. Some of the challenges I mentioned up over here, methods to improve utility of LLMs, prompt engineering, and most important coming up is knowledge graphs for future neurosymbolic AI. Future directions, the important directions would be regulations, guardrails, governance framework, benchmarking, and performance monitoring. And in summary, we know this is a transformative technology. We need to focus on the real value and cut through the hype. We need regulatory guidance, collaborative approach. HitLab provides an excellent platform, and I'm so thankful to this opportunity to speak, and thank you for your time.